Well, many pharmacies aren't wasting any time implementing changes that allow them to prescribe treatments for 13 ailments. Kristen Watt is a pharmacist and independent community pharmacy owner in Bruce County, and she joins us live now via Skype. Good morning. So, Kristen, today was your first day putting these new changes into place. How will things work in your pharmacy when customers start coming in with one of the ailments on the list?
Good morning. Thanks for having me. So the first thing that we're putting out there is a lot of changes onto our website and our social media because we aren't a walk-in clinic. We're encouraging patients to call ahead, do some screening online. We've updated our website. They can do the intake online and actually book an appointment. As you know, pharmacies are very busy in Ontario, so running this as an appointment base will be really important for our success here. We actually already have an appointment booked for this morning. I was just in and checked, so this is very exciting for us, and we're ready to go. On these minor ailments that you're showing there. These are things that we were already handling in pharmacy aisles, triaging, referring out if we were concerned about red flags and things like that. The big change for us now is that we're able to access a variety of different medications that we couldn't necessarily prescribe for our patients. So we're ready to go here.
And Kristen, you know, with our healthcare system so strained these days, you're really calling this a game changer. So what is the demand like for these changes?
Great question. So I would say last week on Thursday or Friday, I probably had 5 or 6 patients who came in knowing that this was coming and asking if we could. And I was like, I can't necessarily give you what I'd like to give you now. This is what I can offer here. If I think you should see your family physician, if I think you should go to Emerge, we were already referring those out. So I think the demand will be where it's already been for us. So the expectations that community pharmacists could provide a certain level of care was already there. It's just our access to different medications. Some pharmacies will be busier than others. Not all pharmacies will be equipped or ready to offer this due to staffing constraints and time constraints. So it may be a bit of a slow roll, and some may choose not to offer it completely. So it's going to be very individual.
Absolutely. Yeah, we know that this was announced, before the new year, went into effect January 1st. And like you said, it could be a longer ramp up period. Now, Kristen, have there been conversations about whether or not some of these ailments should be allowed to be filled by pharmacists?
Absolutely. The pushback on Twitter has been really loud and at times difficult to hear because this is something we are completely trained to do. So having our integrity come into question with respect to conflicts of interest, with respect to us being able to assess and recommend, for example, there's questions about if I'm going to know the difference between pink eye or something that's an ulcer in the eye, or if I'm going to know the difference between hemorrhoids or cancer. The reality is our patients are already presenting to us in community pharmacy with these concerns, and we have already been triaging these patients, helping them manage their symptoms until they can see their family doctor, helping them manage their symptoms until they get to the emergency room if we think it's warranted that they go that way. So I think it's really important to understand that this is generally a gross underutilization of our skills. We are so highly trained and ready and able to help the system. In Alberta, pharmacists have been doing this for nearly 15 years and prescribing for nearly everything for almost 10. And as I point out a little flippantly at times, the sky hasn't fallen because truly this is what we are trained to do. And we are very good at knowing what we're not capable of and being ready to refer out. Pharmacists are part of a patient's healthcare team. We're not the only part, and we absolutely know that, and we want to work really closely with physicians and other prescribers in maintaining continuity of care for patients. We're just here to help in the way that we are trained to do.
All right, Kristen Watt, independent pharmacist, appreciate your time and good luck today. Thank you.
Thank you.